Cardiomyopathy UK is a patient-led charity. Of our 11 trustees currently, 9 either have the illness themselves or are the relatives of folk. We do understand the charity is totally for you, our people. No longer patients or members, but our people. We look forward to seeing you at our national conference in London.
So this is just a bit about me. I'm based out of London in cardiac rehab. Some of you may have heard of what cardiac rehab is, some of you may have not, but hopefully by the end of today you might understand a bit more about cardiac rehab and how it may have helped you, or how it could help for kind of future reference, and also other options of support networks in relation to exercise and how you might be able to avail of that, be it online, be it in your local community. So just a bit of a disclaimer anyway, just to say that it's not kind of personal advice that I'm giving here today. We're trying to just beat on the same drum that exercise is encouraged, regardless of the cardiomyopathy type you have. It just needs to be more individualized to you and your specific condition, and depending on kind of comorbidities that you may have as well. And then obviously, as Adrian kind of mentioned earlier, we've got loads of support on the Cardiomyopathy UK YouTube page that goes into what I'm talking about in a little bit more detail, on devices, for example, ICDs, etc. If you wanted kind of more information on that. These are just the aims of that we're kind of looking at today. And we kind of go through these in kind of step-by-step process. And the idea of it today as well is that I'm not trying to kind of say what you already know, in a sense that you've probably had multiple consultations about different topics in relation to your condition. So I'm hoping that we can maybe try to change your framing around exercise in relation to by the end of this conversation. So this was a survey that was done in 2023. Sorry, I'm not going to reference this correctly. I had some notes with each slide, but I can't really see it at the moment, so apologies for that. So yeah, do you know the pink on this? Is it?
I wonder if we got a slightly older version. Benjamin, is there notes at your end? Oh no, sorry.
Yeah, no worries. So apologies, I'm not going to reference this properly in relation to it. It was done in conjunction with Cardiomyopathy UK. And we can see there in relation to cardiac rehabilitation, only 12% had access to cardiac rehabilitation, which is kind of a structured form of exercise. And then you can see on the blue one on the right-hand side, only 9% were actually referred for physical activity intervention. And down at the bottom, then you can see that only 60% had a significant effect on exercise, or they totally stopped. So this is why we're having this conversation here today. And in relation to supporting the heart, we tried to look at it as a method of 4 pillars. So with patients, they might have been given exercise restrictions around the aerobic side of things, but just because you may have been given restrictions around that side, you can still focus on the other elements. It's kind of working in relation to teammates. So kind of in a supportive manner. So just looking at aerobic exercise here, it just helps the heart work more efficiently. That's why you want to engage in aerobic exercise. It builds stamina without straining the heart. That's why you want to kind of work on it. And just to make the activities feel easier and make your kind of recovery quicker as well. And activities like that might be elements of walking, might be cycling, some kind of water-based activities. Signs of overexertion then just might be in relation to your breathing, might be feeling you're getting a bit out of breath, or in relation to also fatigue. So when you do the activity in the hours that follow or the following day, you might be feeling a bit overexerted or feeling very kind of low on energy. That might be signs that you may have done too much too soon. This is more specifically now muscle strength. We want the strong muscles act like a mechanical assist, easing the load on the heart. So in relation to stronger muscles, we put less pressure on the heart. For example, in relation to your legs, they're big muscle groups. They take a lot of energy when you're kind of walking or standing or kind of going up and down the stairs. So if we can strengthen the legs by through sit to stand, simple base exercises like that, it would help with muscle kind of function, and also helps with takes the pressure off the heart as well. So one of the first things we find with heart patients is just strengthening the legs can also makes it easier on the heart. In relation to physical activity, this is kind of elements that you might do in your day-to-day activity. Light, regular movement keeps circulation steady and supports overall health. And we want to add fitness through consistency, not intensity. In relation to this, we want to have more energy throughout the day and have fewer off days. So we try to look at this as well as it was mentioned by Christy earlier in a holistic approach. That's why we try to look at these kind of 4 pillars. And also exercise or physical activity is part of a wider picture in relation to your recovery or rehabilitation. And in relation to balance, stable, smooth movements, knowing to lower the cost of exercise. I have a 9-month-old at home at the moment, so this is a nice little break for me. I'm kind of lacking sleep. But purpose then is just to keep the movement safe, confident. Here might be just a tandem stand, kind of one foot in front of the other, holding onto something for a bit of balance, one leg, it's stability, such. So we're just trying to work to your ability, work to your condition, also work to your stage. As it was mentioned earlier, we are on a patient journey, so when you were first diagnosed, your exercise restrictions might be quite limited. The further you go along, the months, the years, the exercise ability kind of expand. It might become more inclusive of what is allowed and what is kind of what you should be more mindful of. So that's what you hear in your initial appointment in relation to exercise or physical activity doesn't mean it will stay with you for the rest of your lifetime. So it's something to be mindful of. And in relation to the health benefits here, we know that in relation to cardiomyopathy patients that once you receive a diagnosis, a lot of people restrict their exercise or physical activity. Cardiomyopathy patients are less active in relation to their job role and also their general activity. We know that there's up to 40% of obesity in relation to cardiomyopathy patients. So there's a lot of health benefits to engaging in exercise or physical activity. We just need to look at it a bit more holistically. And these are the recommendations or kind of guidelines. And Jane was kind of touching a little bit earlier on the kind of genotype, phenotype, which can influence in relation to exercise ability. But as you can see at the top there, regular to low moderate exercises are recommended for all individuals with cardiomyopathy. And an individualized risk assessment should be performed. So that's looking at frequency, intensity, time, type, volume, and progression. And that's not something that can be really discussed in your consultation with your cardiologist. That's why it's good to get that kind of specialist support. So some individuals like myself, speaking with the Cardiomyopathy UK charity, they can kind of have these conversations with you, put you in touch with some individuals that can have these conversations with you, so you get that kind of one-to-one, more personal advice. Because ultimately, I'm working with Adrian at the moment, and we're kind of looking at sometimes when patients have a conversation with the consultants, it's usually a kind of a closed question scenario of like, can I do this? And they usually say no, and then you're kind of, okay, as opposed to kind of saying, we kind of might advise you to restrict a certain level of activity at the moment, but once we know more about your condition, let's revisit that. What are you doing at the moment? Let's build on that. So we need to be more kind of informed discussions around that. This is what it goes on to then. You should challenge your health professional. Kind of what have they recommended? Avoidance of certain activities. Sports, what duration? Can you do 30 minutes of walking a day, an hour a day? What intensity is that? Is that low, moderate, high intensity? For what duration as well? In relation to strength training, like weights, It might be elements like kind of activities that you could do at home. Are you allowed to do that? If you want more information on that, where can you go, for example? It's a lot that can be discussed. So what we're trying to avoid is trying to stop asking like yes/no questions and just try to be more informed from an exercise point of view so that you can kind of get more specific, tailored advice to yourself. And this is the challenge that I see as a clinical exercise physiologist. Sometimes people ask me, can I do this or can I do that? And it's really hard for me to answer that. And you can see it might be hard to answer that question in a clinical appointment as well. All these factors outside of your cardiomyopathy influence what exercise we would recommend for patients. So your age, your gender, what medications you're on, previous exercise history. So have you exercised before? Were you a gym goer? Were you a cyclist? Were you a walker? So what's your kind of literacy in relation to movements, in relation to doing strength exercises? So it doesn't matter what level you're at, we just need to have a better understanding so we can tailor it and work in kind of a step progression. And hopefully this is kind of gives you a bit more insight as well, that when you do ask these questions, then it can be a bit, conversation can be cut short. This is why sometimes they don't really have the time to go into the conversations with you. They're more concentrated on your condition, your medication, your symptoms, as opposed to exercise, nutrition, psychology. It can be quite a kind of a challenging area to look at when you're speaking with your health professionals in these kind of short sessions. In relation to what is the best exercise for you, this is more individualized to you. And there isn't, okay, you should do this or you should do that, you should engage in weight training, you should engage in cycling, you should engage in swimming. It varies from person to person. And ideally it's just trying to find, going back to that 4 pillars, looking at those 4 elements of the cardio, the strength, the physical activity, reducing sedentary time. What are you doing in those 4 elements? And is there an area that we can improve or kind of modify to help move you forward? Then in relation to safe structure, in relation to patients or how we structure a program, it generally follows these kind of same principles, where you would start at the beginning of your session, kind of a lighter intensity, moving up the intensity to kind of maybe low to moderate exercise, and kind of adding a cool down then at the end. This just allows the heart to respond naturally to the exercise. So for example, if you want to do movement and you just start jogging on the spot, all of a sudden, that's a sudden increase in exercise. You might feel a little bit out of breath. An example of that as well might be when we're doing exercise in a structured format in our programs. We have usually a 10 to 15 minute warm-up, 30 minutes of a main phase, 10 minutes of a cool down. Patients respond quite well to that. But then we often hear stories of patients kind of maybe watching TV at home and then all of a sudden want to go upstairs and they're feeling out of breath, feeling challenged, even though that going up the stairs was much less intense than what we'd have done in the classes. So it's just about kind of learning your body, learning to adapt, and kind of in relation to understanding how your body responds to exercise. And the more you kind of engage in activity, you get a better understanding, and that will help you to recognize the signs and symptoms of what's normal and what's not so normal when it comes to activity. When we talked about earlier about like kind of low, moderate, high intensity, so low intensity exercise might be anywhere from around 9 to 11. So it's something that you're engaging in and you can easily have a conversation with that. Moderate intensity might be up to 12, 13, maybe in a range. And then high intensity might be around 14, 15, 16, where you may be struggling to have that conversation. And going back to the guidelines that we looked at earlier, most cardiomyopathy conditions are encouraged to do low towards moderate intensity. So anywhere from around 6 up to around 11, 12. If you want to go beyond that, in relation to somewhat hard, getting your heart rate up, that's why it might require more of an individualized discussion. And if you want to get back to even high intensity exercises, which can be kind of allowed in some conditions, particularly around HCM. In relation to genotype, phenotype, that's where a more individualized discussion is warranted as well. How can you support your health professionals or cardiologists in relation to this decision? Sometimes patients just say, I want to engage in activity and I feel fine, and the consultant or the nurse practitioner is just taking your word on that. And it's very subjective. Can you give them some information in relation to smartwatches? Like, this is my heart. Like, when I work with patients privately, it's just you have a bit more scope when you work with patients privately as opposed to in a group setting with 10 to 15 patients. We often discuss about getting a heart rate watch. We would ask them to wear that watch through their exercise programming. It would show their heart rate pattern during that programming. And then we would use that information to go back to the consultant saying, this individual has engaged in this exercise, this is how their heart rate responded. Do you allow us to continue at this intensity? Can we up the intensity? And it just allows a more informed discussion. Also as well, if you're being tracked every 1 to 2 years, every 3 years by your consultant, you're allowed to see the progression as well. Okay, you've been engaging in this level of exercise for this period of time. Your condition hasn't worsened. It hasn't gotten worse. Your symptoms are the same. Was it Julie and Mark were talking about earlier in relation to your daughter about the ICD and about turning it off? That was an informed decision because it noticed about the condition hasn't worsened, etc. So that's the same with exercise as well. You're engaging at this level of exercise for X number of months or X number of years. It hasn't changed your condition. Can you move on to the next level in relation to intensity? Also as well, you're talking to the consultant about how you're educated in relation to, you add in a warm-up, you will add in a cool-down. You know what the symptoms are like in relation to overexerting yourself. This is what your recovery is like. You're talking about specific durations. You're talking about specific intensities. So you're just trying to make the conversation a little bit easier for them. Then some myths and facts then. Harder means better. What we want to do is smarter beats harder. So in relation to your frequency, intensity, time, type is in, are you doing walking, are you doing cycling, are you doing swimming? The volume, are you doing 30 minutes, 10 minutes? And the progression is how you will advance that. If I can't run, why bother? I often seen patients come into the program and high intensity exercise or running is how they identify, particularly if the patient was a marathon runner. So and if you take that away from them, or if you take an activity away from them, it sometimes can affect in relation to how their kind of psychological ability going forward, because they've identified by that sport or by that activity. But ultimately, as we were saying, this diagnosis is a journey, and the research changes over months, over years. So while you might be restricted from running, for example, you're still building a base at the moment. You're looking at alternative forms of exercise, be it strength training, be it balance training, looking at physical activity. So when it does get to the conversation about doing higher levels of training, you have been working on your baseline of activity until that point. Weights are dangerous from my heart. We want to look at light, moderate loads. So when you are doing kind of weights that you feel comfortable in this, it's generally weights, generally fatigue the kind of specific muscles like the arms, the legs. It doesn't have a whole real challenging effect on the cardiovascular system compared to kind of walking, for example, or kind of brisk walking. So it's a bit more localized, but it's good to do that in kind of an informed decision. Sometimes it might be as simple as sit to stand, kind of wall push-ups. You get exercises that you could do at home. There's loads of exercise videos online from kind of proper sources as well. So then if you've missed a week and you feel like you're back to zero, you start again, but maybe add a reduced intensity and start building that up. Only long workouts count. So if I can't go for a 30-minute walk, or I don't have the energy, or I don't have the time, there's a thing called exercise snacks, where you just do 2 to 3 minutes of activity and kind of building that up. So at the end of the day, you might have done that a few times, and you may have done like 10, 15, 20 minutes of activity by the end of the day. And beta blockers, that can affect your heart rate response and any kind of atrial fibrillation, etc. So sometimes heart rate watches are not the best in relation to that, or tracking your heart rate. So then you just go by RPE, rate of perceived exertion, that scale earlier. How do I feel? How is my breathing? And use that to modify or progress your exercise or to manage it. And this is just a patient journey back to exercise. Now this is kind of an ideal journey, is that when you have the diagnosis that you might be given, referred to cardiac rehab, or you might have access to specialist support. Sometimes there can be frustration around that cardiac rehab in relation to, was it individualized enough for you? But hopefully by becoming informed yourself, you can have more specific conversations and ask more specific questions. And then we're hoping to get you to a gradual return to activity. And we're hoping to shift your confidence and improve your sense of identity. And these are different exercise resources then available. Phase 3 is the area I work in. Phase 4, that's just that's just community exercises that you can be referred to, where you work with kind of qualified cardiac individuals in a group environment. And that's usually kind of local to where you live. You have GP referral programs, where if you have a kind of various kind of like diabetes, cholesterol, obesity, anything, that you can just speak to your GP and they can refer you to local programs. And you've NHS videos looking at strength, looking at cardio, looking at core exercises, looking at balance, that can kind of give you more information. You've got community support groups in relation to local gardening, local walking groups that have been helpful for you. And in the British Heart Foundation, obviously Cardiomyopathy UK as well. And then just kind of some points then to finish on about when to modify exercise. And as I was saying earlier, this is something that you will get to recognize in relation to the more you exercise, or not the more you exercise, but the further you get away from your diagnosis in relation to the weeks, the months, you're getting to learn your body, how your body responds. So it becomes really easy to spot some of these signs or symptoms. And then it's just some of the conclusions then that we want to finish on. And happy to answer any questions as well. Hopefully it was informative, and hopefully it's kind of changed your kind of discussion around how you might have with health professionals. And then just to finish on this, in relation to the research, there was very limited, particularly in relation to hypertrophic cardiomyopathy. Everyone was given the same kind of advice: don't exercise at this level. But now it's coming a lot more individualized, as Jane was saying earlier. And this is kind of coming across the board with the rest of the cardiomyopathies as well. The more research we get, the more allowing of exercise ability we're getting with patients as well. And then this is just 2 recent studies that were published in relation to high intensity exercise in patients with hypertrophic cardiomyopathy, which I was involved in that study. It was done at St. George's. And then risk stratification guidelines for patients with cardiomyopathy as well. So these are only 2 recent ones that weren't available a number of years back. So this is what's used to guide clinicians these days in relation to exercise guidance. So if you were diagnosed with a cardiomyopathy a number of years back and you were given exercise advice, these publications have helped change that advice today. And this is just kind of why you would want to, or why you should engage with individuals like myself, or try to get that more personalized one-to-one conversation. It feeds into your wider support team and how we can support you going forward.